Hey students, so this is your respiratory lab presentation. So starting by this unlabeled slide, you guys can see that we have the upper respiratory area here. We can see a lot of important structures. From the beginning, we see a very obvious one, which is the nasal cavity, right? And then we have the pharynx, starting from here all the way down to here. So we have nasopharynx, and then this one in the middle is oropharynx, and then laryngopharynx because it's close to the larynx, right? Okay, so moving from here, we can see other structures that are pretty important, okay? Such as the tonsils. We have here the lingual tonsil, the palatine tonsils, and then the pharyngeal tonsils, okay? Also, these little empty spaces are known as the sinuses. You guys are familiar with the sinuses either by your own experiences getting infections there, and when they get inflamed, they are not a fun thing to have. Moving forward, we see here different important structures, okay? So I know that some people get a little bit caught up with this and just get a little bit also confused. So just follow up with me, okay? So from top to bottom, you guys can see here that there's a frontal sinus and then a sphenoidal sinus. The name of those cavities are gonna be named after the bone they're located in, okay? So as you guys notice, it says sphenoidal sinus, so it's in the sphenoid bone, right? Same thing for the frontal sinus, so they are in the frontal bone. There are ethmoidal sinuses as well, and they are maxillary sinuses, and surprise, they're in those bones, okay? Moving forward, we see here three important structures. The superior conchi, the medial or middle conchi, and then the inferior conchi. They're structures that basically look like turbines. So if you see it from the front, it will be like something like this. They're just structures that helps us lubricate the air and also get it moist and warm, because our lungs don't like cold air, because that gets us at a higher risk of a respiratory infections. And as you guys can see, there are little spaces in between those conchi. So as you guys can see, between the superior and the middle conchi, there is a meatus or meatuses. So they kind of follow the same pattern as the upper or superior, middle, and inferior. So we have a superior meatus, a middle meatus, and an inferior meatus. Be mindful of how the structures are located at and where they are at, okay? So those are the conchi and the meatuses, okay? Now to your front or interior part, we have the nasal vestibule, so this is kind of like the entrance of it, okay? This is kind of like the nasal lobby, and anterior and inferior to it, we have the nostril. This is what you can see when you're talking to a person. You see their nostrils, right? Those little holes in their noses, okay? Now in the back, we see this area known as the posterior nasal aperture, meaning that's the posterior opening. This is the area that is closer to your pharynx, okay? Now we see here the hard palate and the uvula, okay? And all this is known as your palate. You have a hard palate or a bony palate, and then a soft palate, right? And again, you guys can see here the tonsils. They are located in those strategic locations because they are a point of defense. So as you guys can see here, we have a pharyngeal tonsil, we have a palatine tonsil, and then a lingual tonsil over here, okay? These are also normal structures that you can see because this is the oral cavity where we can breathe, but ideally, we always will breathe from here, right? Now moving forward, we can see here the same structures we've been talking about, the nares, also known as the nostrils, and then past the nostrils, you guys will see the vestibule nasal cavity. All right? And then you have your nasal cavity proper. There is a posterior nasal cavity here, and these little friends, superior, middle, and inferior, will be your conchi, okay? And the spaces in between those three will be the meatuses. And what you guys are hearing right now is one of my parrots going crazy, okay? So now you have a frontal sinuses here, and then you see a sphenoidal sinus, and you guys cannot see it here because of the view, but there's an ethmoidal sinuses, and there are also maxillary sinuses, okay? Hard palate, soft palate, and you guys can see again here the tonsils. Okay, this area that I'm gonna highlight in the red, of course, is your pharynx. Pretty important because, as you guys can notice, we share that space with our digestive system. Okay, also pretty important here that we notice is this little hole here. This is the opening of the pharyngotympanic tube. This is the connection to our ears. Okay, so you guys can relate. If your throat gets sore and gets inflamed, sometimes this area is also affected, and then your ears are irritated, and then you get an infection. So as you guys can see here, it's kind of the same structure, but we're just labeling more stuff. So we have the superior conchae here, and then the hole or the space that is coming across is the superior meatus, and it kind of follows the same pattern. Middle conchae, middle meatus, right? Inferior conchae, inferior meatus, okay? And the whole purpose of this is air that is coming in is gonna warm and turbinate and get warmed up. This area is highly vascularized, highly moist, in order to get air moistened and follow the pattern. So it gets nice, toasty, and moist to our lungs, so we are ready for the gas exchange. That is the end point of all this, okay? Also, we can see some structures here that are pretty important. The tonsils, as we have mentioned about, they are immunological pieces of defense. If you guys can see, there's a lot of stuff coming in that cannot be beneficial for our bodies, so we need to make sure we are protecting them. Okay? Okay, so what your friends seeing here is the same stuff that we have talked about. The good thing here is now you guys can see the ethmoid air cells, also known as the ethmoid sinuses. And also you guys are seeing the division of the pharynx, all right? And we have talked about this, friends, already, okay? And as you guys can see, we are sharing real estate here with the digestive system, but at some point they divide, they're either going to the digestive system or the respiratory system, one at a time, not at the same time, because otherwise we'll be choking to death, right? All right? Then you guys can see again here the opening of the pharyngotympanic tube that is going to connect to our ears, okay? Same stuff here. What we're seeing here is just kind of the same stuff. I apologize for my bird screaming. The conchae, we have talked about them. We talked about the soft palate and also the hard palate, the uvula, that is part of the soft palate, and the epiglottis. This little flap here is the one that is going to close so we don't get food to our airway. This is a close-up, and what you guys are seeing here is the conchae, right? And some of the sinuses. So what you guys are seeing here is the sphenoid sinus and the frontal sinus, each one located to their respective bone. What you're seeing here is your middle nasal conchae, the inferior nasal conchae, and this little friend here, of course, is the superior nasal conchae. The spaces that you guys are seeing here are, of course, the meatuses, okay? So again, air is going to come in this way every time we aspire. And air, think about it as a fluid as well. So it's going to have some turbulence. So air, every time we breathe, is going to kind of like turbulate. That way it gets warm and moist. These areas are highly vascularized. That's when we get a nosebleed. It is so prolific because there are a lot of blood vessels here. Having a lot of blood vessels in an area is going to increase their temperature, okay? Same thing here, just in a different cadaver. You guys are seeing the same structures, okay? So take your time to review these areas, okay? What you guys are seeing here is the same. So as you guys can see now, at this point, you guys should be familiar with the following structures. A conchae, of course, superior, middle, inferior. And then you guys can see here very clearly the meatuses, okay? Now you guys have the nasal vestibule and the nostrils here. Now you have the posterior nasal cavity and the anterior nasal cavity, but also you guys can see here this hole. This hole is the pharyngotympanic tube opening, okay? You guys can see here the hard palate and then the soft palate very clearly, and see how important this friend, even though we cannot see it because when we open our mouths, we don't see this area here, is protecting pretty good where things are being closed, right? Again, I'm going to highlight this in the blue. the pharynx, okay? Nasopharynx, oropharynx, and down below will be the laryngeal pharynx. Moving lower, we have very important features here. What you guys are seeing is the same structure, just one that is, of course, anterior and posterior, okay? This friend here is the thyroid cartilage. It's named after this friend, who is the thyroid gland. The thyroid gland is going to cover another important cartilage. It's a cricoid cartilage, and here's a little bit like transparent, and you guys can see it here. This is the cricoid cartilage. Something you guys might notice is this friend is thinner anteriorly, but it's thicker posteriorly, okay? So these two friends here are the same cartilage. It's just this is the posterior view here, and this is the anterior view, okay? Now, the other pieces here, again, this is the thyroid cartilage, this is anterior, and this is posterior here, okay? These little friends here are known as the arytenoid cartilage. These friends are going to help us to attach to the vocal cords. This big friend here is a flap that is going to protect the glottis, known as the epiglottis, okay? You see it here posteriorly, and also you see it here anteriorly, okay? And this friend here you guys are familiar with is the hyoid bone, okay? This fat friend here, of course, is the thyroid gland, and these four little friends are the parathyroid glands, okay? What you guys are seeing here as well are the rings of the trachea. They're also cartilage, the tracheal rings. They are pretty important because they prevent the trachea from collapsing, but also gives it flexibility. Okay, so here what we're seeing is from the side. This is a cross-section cut of the larynx, okay? What you guys are seeing here, of course, is the hyoid bone. This one is anterior, this one is posterior, okay? So what you guys are seeing here is, of course, the thyroid cartilage, okay, and the cricoid cartilage. As you guys can see, this friend here gets bigger as we go posteriorly, okay? These friends are the pyramid-shaped cricoid cartilage, and this is the corniculate cartilage that we don't mention because it's just itty-bitty, okay? Now, what you guys can see here are two important things. The vocal cords, okay? I'm gonna give it simple. We have true vocal cords and false vocal cords. Inferior are the true vocal cords. I'm gonna repeat that. Inferior are the true vocal cords, okay? Superior are the false vocal cords, okay? This friend here is, of course, the epiglottis. This friend is gonna go down to protect the airway so food doesn't go in, okay? See here what we're seeing are the same tracheal cartilages. Here what we're seeing, of course, is an anterior view of your larynx, but here we can see a lot of important stuff, okay? So here is the thyroid cartilage, the cricoid cartilage, and this friend here, of course, is the laryngeal prominence, aka Adam's apple, okay? Here what we're seeing are some of the tracheal cartilages or the tracheal rings, and here we see the body of the hyoid bone. Then in the back you guys are seeing a little bit of the epiglottis. Seeing it from the back in a different model, you guys will see this is a posterior view of the larynx. You guys are seeing the hyoid bone. This is the epiglottis. This here are pieces of the thyroid cartilage, okay? Then you guys are seeing here the cricoid cartilage. The little opening here is the glottis, but also you guys are seeing this pyramid-shaped structure known as the arytenoid cartilages, and then this little corniculate cartilage, okay? We're seeing the tracheal rings here as well. Not seeing it from a real person, you guys can see here our friend the epiglottis. You see the thyroid cartilages. You see the opening of the glottis. We see the pyramid-shaped cartilages known as the arytenoid cartilages. You guys are seeing the cricoid cartilages, and hidden, embedded in this, friends, we are going to have the vocal cords. All right, this is a cross-section model. So you guys, what we're seeing here is, of course, the nasal cavity, okay? And also pay attention, we have nasopharynx, oropharynx, and laryngopharynx, okay? You are also seeing the lingual tonsil. You guys will see here the palatine tonsil and also the pharyngeal tonsils, okay? So pay attention to those, where they are located, and so on, okay? Going down to the larynx, we are going to see here that we have the epiglottis, of course, and then we're going to have the vestibular fold, okay? This is part of the vocal cords, okay? Then we are seeing here the thyroid and the cricoid cartilages, and this little frame here, and I'm going to use a thinner marker, is the vocal cord, okay? Or inferior ligament, okay? Or inferior fold. The vestibular fold is also known as the false vocal cord, okay? This right here is a thyroid gland. And see, we have, in a good perspective, the esophagus and the trachea separate already. So we are not sharing the real estate, meaning that food is gonna go this way, air is gonna go this way. Not at the same time, of course. Okay, what you guys are seeing here, of course, is the thyroid gland and a little bit of the Adam's apple, okay? All right, what you guys are seeing here is a good image of the vocal cords, okay? We have the vestibular fold or vestibular folds, and then the vocal cords, superior, inferior, okay? I'm gonna use a different color. False, true vocal cords, okay? When they close, they vibrate and they produce sound, okay? This is in the flesh. This is a little bit denuded of the meat, let's say. So what you guys are seeing here, of course, are the true vocal cords, okay? And now we are producing sound. They close, they vibrate, and then they produce sound. These are the true vocal cords, and these are the false vocal cords. Think about it, inferior, true, superior, false. And this is the process, of course, right? Okay, so they're open, they're letting air in, but when we need to talk, we close them to vibrate and produce sound. All right, so what you guys are seeing here is the lower respiratory tract. The first piece that we're gonna talk about is the trachea. As you guys can see, is long, probably like 14 inches long. It has the tracheal cartilages or the tracheal rings to prevent them from collapse because it's highly flexible. And if you guys think, try to move your necks to the right, to the left, up and down, you never stop breathing, right? Because your trachea is sturdy enough but yet flexible to allow you to do that, okay? When the trachea goes further down, it's going to divide in two, and it's going to have a spot called the carina, which means a pair, okay? And it's going to divide it in two, all right? So we have a left and a right main bronchi, okay? So bronchi is plural, bronchus is singular, okay? Also, you guys can see here that we have a left lung and a right lung, okay? And I apologize again, those are my very chatty parrots, okay? So let's start by the right, okay? The right is bigger because it has 1, 2, and 3 lobes, okay? And the left only has 1 and 2, okay? Also, the right bronchus, it's lower but a little bit shorter than the left one, okay? It's also very important because it has secondary bronchi, okay? You have a superior, a middle, and then an inferior bronchi, okay? And here you only have a superior and then an inferior, okay? And they're gonna branch out again. This is kind of like a tree upside down. We have the branching of the branching. You have the trunk that is gonna divide further into little branches and then ended up in little stems, okay? So with the respiratory system, I think about it as an upside down tree because you have a thick trunk where everything stems out, and then we're gonna have little bit of stems and little branches where the leaves are gonna be located. Okay, so now we are going to have fissures. Okay, in the right one we have a horizontal fissure, even though it doesn't look very horizontal, and then we're gonna have an oblique fissure. This is because we have three lobes, right? One and two, one lobe, two lobes, three lobes, two fissures. And here it's different because we only have two lobes, right? A superior and an inferior, and one fissure. The reason why the left lung is smaller is because it has to share space with the little friend, the heart. Okay? What you guys are seeing here, of course, and it's a dead giveaway, has three lobes, so we have to think about who? The right lung. Superior, middle, and inferior. Horizontal fissure, oblique fissure. Of course, this one is the left. Superior, inferior, and an oblique fissure, right? Side by side, right and left. So think about it. 3 is right, 2 is left. Okay, you guys see the fissures here. All right, so you have a horizontal and an oblique, and here you only have one oblique. This is, of course, if you're seeing it laterally. Now we are seeing the lungs medially, so meaning from the inside. What you guys can see here, of course, are the lobes again. Superior, middle, and inferior. And here, of course, is superior and inferior, and the fissures. Also, something pretty important that you guys will see here is the connecting of the trachea and other important vessels that are gonna go in to the lungs. Okay, of course, we need vessels because we need them for gas exchange. Vessels that are going in and vessels that are going out, and of course the bronchi that are gonna be the air in. Okay, this area is known as the hilum. Okay, pulmonary hilum. Okay, also a little area that you guys will see here is the cardiac notch. Cardiac notch is a dead giveaway because it tells you that it's a notch, especially for what? The heart. Okay, what you guys are seeing here is in the real flesh, the lung. All right, something pretty important that I have to mention here. Think about the lungs as a pyramid. Okay, so you have a pyramid here, right, with all your imagination. The tip of a pyramid is known as the apex. Okay, and then you have the base. Okay, think about the tip is the apex predator, right, because it's at the top of the chain. Okay, so apex, base. All right, and of course this friend will have it as well, an apex and a base. All right, so let me just clean my mess here. And if you guys can see, we have also the superior, the middle, and the inferior. But also you have your fissures. All right, take your time to read this and review it. Okay, all right, so what you guys are seeing here is a histological sample of the lung. All right, and you guys will see it here. Okay, so what are we seeing? Okay, so let's see. We have a lot of like empty space, and it's truly empty space. This is where air is supposed to be. Okay, these very thin walls are simple squamous epithelium. They have to be thin because something is happening here. Something pretty important is going to happen here. Gas exchange. All right, and the gas exchange occurs in the alveoli. Alveoli is plural. Alveolus is singular. Okay, alveoli are gonna be kind of like grouped in a bunch. All right, known as the alveolar sac. Okay, what you guys are seeing here is a pulmonary arteriole that is going to be turned into capillary and going to be surrounding the alveoli for the gas exchange. A bigger structure here that you guys are seeing here is the bronchiole, but nothing else, as I told you guys with lung, as I told you guys with liver, as I told you guys with the small intestine, is very easy to tell apart. Okay, because nothing else looks like lung. Okay, take your time to take a look at this, see how it looks and how the structures look like, okay? What you guys are seeing here, of course, is the respiratory system. You guys are seeing here the larynx, and here you see in the trachea, okay? You guys are seeing all those rings. Those are the tracheal rings that prevent the trachea from collapsing. And then we're seeing the lungs, okay? We see the superior, middle, and inferior lobes of the right lung, and then we have the superior and the inferior lobes of the left lung. What you guys are seeing here is the space for the heart. And if you guys think about it, this is what we call the cardiac notch. If you guys use your imagination, this is like an upside down tree. You see a very thick trunk, and then we see branches that are gonna be turned into little stems where the leaves are going to be at, okay? Again, we're gonna talk about them further. We have main bronchi, secondary bronchi, tertiary bronchi. Then we're gonna go into more in detail thing with terminal bronchi, respiratory bronchioles, so on until we get to the simplest stuff. They are the alveoli, okay? We're gonna deviate a little bit from the lungs and go back to the trachea. This is a cross section of the trachea. Why is this important? Well, let's go by pieces. What you guys are seeing here is hyaline cartilage. The hyaline cartilage is called that way because it kind of resembles glass, okay? This is a piece of the tracheal ring, okay? Then we have an empty space here, and this is, of course, the lumen, okay, of the trachea. If we kind of like zoom in a little bit, and I'm going to use a different color, this is the mucosa of the trachea, okay? This is pseudostratified ciliated epithelium, okay? It's pseudostratified because it pretends to be different layers, although it's only one. Also, there's a lot of goblet cells, and as you guys know, the goblet cells are what? Mucus, right? And it has cilia. Cilia are all those little hairs that you guys can see here. It's like a little brush here. You guys can see it here. It's just all this lining, okay? And what they do is they are constantly moving in one direction. Dust, particles, stuff that we don't want in is going to be trapped by the mucus, but also be taken up in the form of phlegm that we're going to either spit or we're going to swallow. Here is just like a more concentrated area of the trachea. We are like concentrating the mucosa. What you guys are seeing here is the stuff that we just talked about, cilia. This is going to be moving like grass in a meadow. They're just moving constantly to trap particles with mucus and move it to out of the respiratory system so we do not get sick. Pseudo-stratified columnar epithelium with what? Cilia and goblet cells, okay? What you guys are seeing here is kind of like submucosal area that has lamina propria, connective tissue. Boom. All right, so we have here a mucosa and a submucosa, okay? And then just a tiny bit of the cartilage, okay? We already talked about the epithelium that is going to have what? Pseudostratified columnar epithelium with cilia and goblet cells in order to trap particles, move them away, and take them out of the respiratory system. What you guys are seeing here are pretty important spaces, all right? We are seeing here the lumen, of course, empty space, but also you guys are seeing a tracheal ring, okay? There's a little bit of muscle here, okay? But this is the trachea, of course, but the trachea is anterior to this friend here that we already talked about, the esophagus. See how they look? The esophagus, in theory, and it will collapse because we only need it when we are swallowing, and it has to be patent, meaning that things can go through when we need it, like when we swallowing stuff like food or saliva. On the other hand, we need this friend here to be patent, meaning that it has to be open enough sufficiently to breathe. Think about animals or people that have a floppy trachea. They struggle to breathe. Some dogs, like let's say like a bulldog or a pug or anything that has like a shorter face, they have sometimes a floppy trachea, and sometimes they sound like they're coughing all the time. But it's because the trachea is collapsing all the time. So what you guys are seeing here is a complete representation of like the very end. So here we are by the leaves. If we're using our tree analogy, these are the branches and these are our leaves where the gas exchange is going to happen. Okay, so what you guys are seeing here firstly is the alveolar sacs. These great bunches are the alveolar sacs. Of course, they get their name from the alveolus. If they're a bunch, we say alveoli. All right, alveolus singular, alveoli plural. Okay, then you guys are see these very thin walls, and they're important to be thin because the gas exchange is going to happen. To your right, you guys will see the whole network of deoxygenated blood coming in via venules and then turn into capillaries. Capillaries are going to have the gas exchange here, and then it's going to return in the wave of arterioles, and then our arteries, and going to go back to its respective circulation. Okay, these are of course alveolar ducts, and this that has like a little like sacs here are the beginning of the respiratory sacs, of the respiratory bronchioles. Same thing that we have seen before, as you guys can see, is lung. Nothing else looks like lung. Alveolus, one sac. Why do we have a brain here? Well, it's very important. We breathe unconsciously, and that is by our autonomic nervous system, specifically our brain stem, which is this piece here. Okay, of course this is anterior, this is posterior. This area with the brain stem, the pons, and the medulla oblongata are the ones in charge of controlling our breathing. An injury to this area and that's night night, we die. Okay, so that's why when some people get a stroke in this area, they still can breathe, they still can do like the basic stuff, but there's no conscience per se. If we have an injury at this level, we are going to die. Okay, now back to a more complete view of the respiratory system. So what you guys are seeing here is, of course, starting from the beginning, and this is a good opportunity to talk about the upper respiratory tract and then the lower respiratory tract. Okay, what you guys are seeing is also a piece that is pretty important, known as the conducting zone and the respiratory zone. What you guys are seeing at this point is the conducting zone that is going to go in, and is going to be called conducting zone until the very end to the terminal bronchioles before we start to having sacs. Okay, the point of this area, meaning the conducting zone, is to carry oxygen to moisten and warm it up. Okay, also what you guys can see here is something that is pretty important, are the lungs. If you guys can see, 3 lobes mean right. Okay, 2 lobes mean left. Okay, we have a cardiac notch here, we have the horizontal fissure and the oblique fissure, and then I think I blocked this frame here. There you go. This one, of course, is the oblique fissure of the left lung. Okay, as you guys can see, it kind of seems that the lung has kind of like a little membrane surrounded. Well, that membrane is not there by error. This is a membrane that protects but also helps with the respiratory expansion of the lungs. That is called pleura. As we were talking about a membrane that is surrounding an organ, is going to call visceral pleura. There's also a parietal pleura that is going to be attached to the thorax or the thoracic wall, and both of them are going to be rubbing against each other, and there's a space called the pleural space. Okay, we haven't talked about this friend. This friend is the diaphragm. It's pretty important because when it goes down, it helps our lungs to expand, right? But when it goes up, it helps them to decrease or go back to their basics. Okay, also pretty important, we have the apex of the lungs and the base of the lungs. All right? Lateral, medial. Okay? This is the trachea, this is the larynx, pharynx, okay? Nasal cavity. Same thing here. Take your time. You guys are seeing good examples of the conchi, the nasal cavity, the posterior nasal cavity, okay? The opening of the pharyngotympanic tube, the thyroid cartilage, the cricoid cartilage, okay? The epiglottis, the trachea, the carina, the lungs, okay? The rib cage or the thoracic cavity, the diaphragm, the cardiac notch, okay? Here what we're seeing is it's different. I mean, there are different stuff here to like unpack. Okay, starting from the top, you got the hyoid bone. You have the epiglottis of the larynx. This is the flap. Okay, we have the thyroid cartilage. We have the cricoid cartilage, and of course we have the thyroid gland here. Okay, and of course you guys can see here that the trachea is going down. Okay, then we have the right lung and the left lung with its respective fissures, okay? Oblique fissure only on the left side, oblique fissure on the right side, horizontal fissure on the right side, of course. And of course, our friend here, the heart is making its appearance, okay? Take your time to disinfect this and take a look on it. Now, what you guys are seeing here are the same structures, but they're open, meaning in the sense we can see inside. So here we have the carina, right? But we have the primary bronchi. This one is, of course, the right, and this one over here is the left, okay? They're going to branch out. This is the branching of the branching out, okay? Secondary, and then we're going to have tertiary. As you guys can see, it has different names. Secondary because secondary go to each lobe, and tertiary when they go to the segments, okay? So primary, secondary, and tertiary, and then they're going to turn into more branching to terminal bronchioles and then to respiratory bronchioles. All right? Same stuff here. See how they're branching out to each different. See the branching here? There are two because they are going to the lobes. There are two here and there are three here. Makes sense? We're seeing the same structures here. Okay, so one of the things I'm gonna touch base with you guys next time we see each other is talk about the respiratory zone, the conducting zone, what is upper respiratory tract, what's lower respiratory tract, and also the volumes and the capacities of the lungs. There's a lot of this impact here, and I want to make sure you guys are seeing here and understanding this because this is pretty important stuff. Okay, I appreciate your time, guys. Thank you.